How's it going today, Jeff?
I'm doing great, Julian. How are you?
Man, I'm blessed by the best, sir. So a couple of different questions that I wanted to ask here that the group came up with was, the first question is, what determines our health insurance rate?
Sure. So your health insurance rate is determined by three factors, and all kind of stems from how you file your taxes, which is why it's so important to work with a professional tax preparer to make sure that your health insurance is done correctly. So the first thing is, how do you file your taxes family size? So whoever is on your tax return is eligible to be on your health insurance policy, and your rate is determined by your adjusted gross income and also your zip code. So where you live, your household size, which is determined by your tax return, and your expected adjusted gross income for the following year.
All right, awesome, sir. Thank you so much. All right, so what documents do I need to show my income?
So most of the time, especially if you're self-employed, I know that a lot of the folks that you work with are going to be self-employed. So it goes by pretty much just a letter of explanation explaining that your income is pretty much just too hard to calculate. You don't know how much you're going to make. So you're going based on this income, and that's pretty much sufficient. If you're a W-2 employee, you submit a pay stub or your last year's tax returns if you think that it's going to be similar for the following year.
All right, awesome. Thank you, sir. All right, so what if I have health insurance through my employer already? What
Sure.
options do I have?
So there's something called the affordability. So if your health insurance plan through your employer is not a qualified health plan, so if it doesn't cover things like annual checkups, physicals, pap smears, mammograms for free, chances are it's not a qualified health plan and you can opt out. The second thing is if the health plan is offered through your employer is more than 10% of your gross income, then it's considered unaffordable and you can opt out and get on a plan with us.
Awesome. That is great value. All right, so what do I need to get started?
Pretty much just, we don't need to see your tax return, but if you know kind of how you're going to file as far as like your household, married, single, dependents, anybody that's going to be on the plan, we would prefer to have the socials. So if you have the socials, that'd be great. And then your expected adjusted gross income. And also, if you have any specific doctors that you want to make sure are in network and any prescriptions that you want to make sure are covered, if you can have that information ready before we get the process started, that would make it go a lot faster.
Awesome. That's some very, very good info. All right, so how soon will I be able to get the coverage?
So if you have been on a plan in the last 60 days and you lost coverage for whatever reason, or if you applied for Medicaid through your state and you were denied, then you would be eligible for coverage on the first of the following month. So for instance, right now it's September 16th, you would get coverage for October 1st. If you don't have or have not lost insurance in the last 60 days, and we're going to be doing it through open enrollment, then your policy will go into effect on January 1st.
All right, cool. And then open enrollment is when? It starts October 15th, correct?
October 15th, we should have the rates for next year, and at which point we'll be able to start processing enrollments. But open enrollment technically starts on November 1st and goes through December 15th. After December 15th, then you'll no longer be able to enroll in healthcare coverage for 2021. So it's really important to make sure you get an application in and choose a plan before December 15th.
Okay, awesome. Thank you so much, sir. And so who would I need to contact?
So it depends. So anything marketplace related, you're going to want to come to us. The last thing you want to do is call the marketplace. They really don't know what they're doing. It's really sad. If it's anything with your plan related, as far as like making your payment, choosing a doctor or seeing what doctors are in network, that's when you're going to want to go through your healthcare provider. So if you're in Florida, it could be any, Florida Blue or Ambetter, Oscar. You're going to want to call Oscar or create a portal online. That's always the easiest way.
All right, awesome, sir. So what type of coverage is offered?
So it really depends on where you live. So if you're in Georgia, it's going to be a very different plan offered than if you're in South Carolina, Texas, or Florida. So really, the plans are very, very regional, and it goes by your zip code and your county. So if you're in one county and there's a county line right across the street, you could be offered very, very different plans. So it's very county, zip code specific.
Okay, but for the most part, are the plans pretty comprehensive to be able to provide for all my medical needs?
Of course. So all the plans, as of right now, cover all your pre-existing conditions. So anything that you've had in the past is going to be covered from day one with the start of your plan. All the plans include things like annual checkups, physicals, pap smears, mammograms, colonoscopies, all at zero copay, zero deductible. So it doesn't matter what plan you choose, all your annual checkups and wellness are covered at 100%, no cost to you.
Oh man, that's awesome. Okay, so do I have to pay any money down?
No. So you don't. I think 91% of the policies that we enrolled folks in for 2020 were actually zero monthly premium. So there was no money down, nothing per month. We were able to get everything taken care of thanks to the Affordable Care Act, which is commonly known as Obamacare. If you do have a payment, you don't actually have to make the payment today. You have until December 31st to make your payment if your policy is going to start on January 1st.
Awesome. Thank you so much, sir. And so what happens if I don't have any health insurance?
So technically, the IRS code still requires that every person who files a tax return, it's mandated that you do have health insurance. The way that you provide show proof that you have health insurance is either with a 1095A, 1095B. So for individual or group coverage, so you want to make sure that you have one or the other when you go to file your tax return. But that being said, the penalty for not having health insurance is actually $0. So even though you are required by law to have health insurance, the penalty for not having it is $0.
Okay, thank you for that intel, sir. All right, and then who can be included on my coverage?
So again, it goes back to how you file your taxes. So if you have any dependents and they're not covered through either Medicaid or through a group plan, we can absolutely get them onto the plan with you. If something's going to change, so let's just say right now your tax return for last year was you were single, but now you're getting married, or conversely, if you were married last year, now you're getting divorced, then you can file your health insurance application how you're going to process your tax return in the following year. So if you want to add on a dependent, just make sure that in the following year you plan on claiming that person as a dependent on your tax return. If you don't, unfortunately, they're not eligible to be on your health insurance plan, but there are some coverage options that we can go through on a case-by-case basis.
All right, awesome. Thank you, sir. And then my last question is, you mentioned something about a 1095A or a 1095B. Where would a person find that information, or how would they get it?
Sure. So 1095B is going to come from your employer. That's the only way to get it. It's going to come from your employer. The 1095A is going to come from the health insurance marketplace, and that usually gets mailed out around January 21st. But at Get Covered USA, we actually have access to your 1095A on January 4th. So if you're looking to work with your tax preparer and you're trying to file your tax return, just have he or she contact us. We'll be able to get it over to your tax preparer direct within usually 30 to 60 seconds.
All right, awesome. Thank you so much, sir. So, guys, that is immense value. So, yeah, that is immense value, guys. So we just appreciate Mr. Jeff Mercado for all of his intelligence and how he's really adding value to our team, and how he's really going to help our leader, Mr. Bass Grant, roll out some great coverage. So a lot of us can really just go full time with this, and our families and things like that will be protected. So, but we thank you so much for your time, sir. We thank you so much for your value, and we're just looking forward to working with you and really helping a lot of families all over, get health coverage, and help a lot of people that want to work for themselves and be independent business owners have an amazing job and amazing coverage so that they can go take their families to the next level. Thank you, sir.